Tonight, on Medical Emergencies, we will witness how hyperventilation is managed in a dental office. Our characters: Mrs. Garcia, an anxious patient coming in for a dental procedure; Dr. Jen, the dentist; Sarah, the dental hygienist; Rose, the office receptionist; and the paramedic who arrives after being called to assist. The patient, Mrs. Garcia, enters the office, visibly nervous, fidgeting. She approaches the reception desk where the office receptionist, Rosa, greets her with a smile.
Good morning, Miss Garcia. How are you feeling today?
I'm okay, I guess. I'm just really nervous about today's procedure. I don't do well with dental work.
That's perfectly understandable. Dr. Jen and Sarah will take good care of you. If you feel uncomfortable at any time, just let us know. Sarah is here. Sarah, Miss Garcia is a bit anxious about the treatment today.
Good morning, Miss Garcia. My name is Sarah. I'll be your dental hygienist. Thank you for coming in on time.
Of course.
If you have any questions regarding the treatment, feel free to let us know. I will also walk you through every step of the procedure. Often, knowing what to expect makes us feel better. You are scheduled for your SRP or scaling and root planing today. Let me take you back to the treatment area. Thank you, Rose. Ms. Garcia, I have reviewed your medical and dental records. Has there been any changes since your last visit?
No changes since last visit.
Are you still taking losartan 50 milligrams once a day for your hypertension?
Yes.
Is the dosage still the same?
Yes, it has not changed.
Are there any other medications you are taking?
No, only losartan. I take it once a day as prescribed, and I take it regularly.
How is your health in general? Your appetite? Have you been getting enough rest and sleep?
Yes, I have. I do feel healthy. I'm just a bit nervous about today's procedure.
That's understandable. Let's take your vitals.
As soon as Sarah was done taking the vitals, Dr. Jen came into the room.
Good morning, Miss Garcia. How are you today?
Good morning, doctor. I'm okay. I'm just a little tense about the procedure.
Oh, I see.
Ms. Garcia's blood pressure is 135/80, which is normal for her as she has hypertension. Her temperature is 98.2, her pulse is 75 a minute, and her respiratory rate is 18 a minute.
Thank you, Sarah. I know we discussed this treatment last month, but are there any questions you wanted to ask Sarah before we start?
Remind me about SRP again. What is it?
SRPs, or scaling and root planning, are also known as a deep cleaning. It's a dental procedure that treats gum disease by removing plaque and tartar buildup and infection in the gums. S, or scaling, removes tartar from the visible surface of the teeth, and RP stands for root planning, and this removes tartar from the roots of the teeth below the visible gum line.
Oh, okay. Thank you, doctor.
All right, I'll see you guys once you are all done.
Okay, doctor, we will proceed. All right, Ms. Garcia, we're going to start. First, we will apply numbing gel. Then we will get the upper right side and the lower right side of your mouth numb, so you'll be comfortable during the procedure. And I can do a better job cleaning underneath your gums. Now open wide. I'm going to dry the area so we can place the numbing gel. Let me take out the applicator and wipe the area. Open wide, stay open.
As they were waiting for that local anesthesia to take effect, Sarah notices that Mrs. Garcia's breathing is rapid.
Miss Garcia, are you okay? How are you feeling?
I don't know. I'm feeling even more nervous, and I can't seem to catch my breath.
Here, let me take everything out and I'm going to sit you up so you can be comfortable. I'm going to have doctor come in. Dr. Jen, I think Miss Garcia is starting to hyperventilate. She's breathing really fast.
Okay, let's just stop everything for a second. And Miss Garcia, I need you to try to slow down your breathing. Take slow, deep breaths with me. Ready? Breathe in and out.
Focus on breathing with us. In through your nose and out through your mouth.
I'm trying, but I feel lightheaded. My hands are tingling.
That's okay. It's just because of the rapid breathing. Let's try and slow it down together. I want you to breathe in through your cupped hands, and this is going to help normalize your breathing.
Patient begins to breathe into her cupped hands, but remains anxious.
Sarah, tell Rosa that Miss Garcia is having a hyperventilation episode. Have her call 911 and request paramedics.
Right away, doctor. Rose, call 911 to request paramedics. Miss Garcia is having a hyperventilation episode.
I will.
911, what's your emergency?
Hi, we have a patient in our dental office who needs hyperventilation.
May I please have the address?
We are at 13112 Bright Avenue, Suite 16, Garden Grove.
Okay, they will be there in a few minutes. Please stay online with me.
I will.
Thank you, Rose.
Sarah, please prepare 3 milligrams diazepam to be administered intramuscularly just in case we need it.
Sure, Doc.
Okay, Miss Garcia, help is on the way. Let's continue to breathe slowly into your cupped hands. Slowly inhale. 1, 2, 3, 4, 5. Exhale. 6, 7, 8, 9, 10. All right, one more time.
Mrs. Garcia's breathing is somewhat calmer, but she still feels unsteady. Paramedics arrive within a few minutes with equipment.
We received a call about patient hyperventilating.
Yes, this is Miss Garcia. She started breathing rapidly during the procedure and we couldn't get her to fully calm down. She's been breathing into her cupped hands and her breathing has slowed, but she still feels lightheaded.
The paramedics started assessing Mrs. Garcia.
Miss Garcia, can you tell me how you're feeling now?
I'm still feeling a little dizzy and tingly, but I think I'm doing better.
That's good to hear. Let's check your vitals and make sure everything is stable.
The paramedic checks Mrs. Garcia's pulse, blood pressure, and breathing.
Your vitals are looking better. I'm going to monitor you for a few more minutes. It seems like the worst had passed, but we want to make sure that you fully stabilize.
Thank you for coming so quickly. Do you think she'll need to go to the hospital?
If her symptoms continue to improve, I think she can stay here. If they worsen again, we will take her to the ER. Miss Garcia, are you feeling up to trying to stand?
Mrs. Garcia nods her head. Yes, I think so. The paramedic helps Mrs. Garcia stand. She's a little unsteady at first, but regains her balance.
Alright, it looks like you're recovering well. It's just take it easy for the rest of the day. Dr. Jens, I would recommend postponing the procedure until Miss Garcia feel more comfortable.
Absolutely. We'll reschedule for another time once Miss Garcia feels ready. Miss Garcia, how are you feeling right now?
Oh, much better, thank you. I'm sorry for all the troubles.
No trouble at all, Miss Garcia. We're here to take care of you. When you're ready, we can reschedule for another day.
Thanks, everyone. I appreciate all your help.